So we have lots and lots and lots of questions, and I apologize in advance. If we don't get to yours, please tackle us during lunch hour. We're here, all of us, all day. Also, I realize that there's two ways for people to submit questions. Some people are putting questions in on the Whova app, because there's a place to put questions on the Whova app. But I'd like to please have everybody put your questions in through Slido so we can try to have one place to look for the questions. So, Roberto, I'm going to start with you. I've tried to consolidate some of these questions because a lot of them are similar. But there are several questions about access to the care at Sick Kids and at Toronto General, either based on the Beighton score or based on geography, and asking about resources for people who don't make it into the clinic and how people can find the care they need if they can't access the clinics at your hospital.
Thank you very much for that question. And I do acknowledge that it is a challenge. As you heard from several of the speakers today, we all struggle with trying to provide the best access to care while at the same time serving the largest number of population possible. There has to be certain criteria, and one of the criteria that both clinics have is related to the Beighton score, and that does make things difficult. When a physician is aware of the reason for concern, we encourage them to be as detailed as possible in their referral. Some referrals are very scant. Please evaluate for EDS. They don't say anything. Based on that, it's hard to decide without that information what is needed, and when we ask for the information back, they are sometimes not as detailed. We are trying to consider alternative strategies for the individual to be able to upload some of the information through our EPIC medical record system. There will be questionnaires that are going to become active over the next few years that may increase the ability to have access. I think that direct communication, as was mentioned before with all the other, if somebody sends me an email, I'm sure to see it and answer. If the physician reaches out directly, generally there will be some discussion and there will be opportunity to clarify what elements make the referral or what resources might be available. One of the challenges, like one of the alternatives I was also noticing is in the panel we have specialists from different sides. Sometimes it makes more sense to make the referral to a genetics clinic. If it's a constellation of symptoms that seem to be rare, the referral might make it through genetics first as an assessment, and if the individual ends up having a condition in the spectrum of EDS, then would be referred to the EDS for ongoing management.
Thank you. Hanna, could you address the question for a patient who is trying to build a multidisciplinary team, and particularly if they have a primary care doctor who's not familiar with Ehlers-Danlos syndrome or hypermobility in general, how would you recommend they go about putting together a team of people to help them?
So that's a question for a clinician who wants to do an MDT.
For a patient.
For a patient, okay, for a patient. I think that's also an excellent question. I think I've got the privilege of having been involved in this for 15 years, and part of the pain management that I've mentioned, which is 8 days, there is one afternoon where I go and meet patients, and over time, my advice, and I share the frustration, the deep frustration of the lack of recognition, and at some point, the complete dismissive approach about, I don't know this, it's not mine. So over time, I would say I've learned from my patients, and then I, teach and learn from everyone. I learned from some people, and I start teaching it. I think in general, first of all, acknowledging that majority of clinicians are not aware. So my advice would be is lower the expectations. Not to say that you would not go and want what you want, but if you lower your expectations, that means you're not frustrated. So that's one. You go to the person, and I would always say you will be the ambassador. be an ambassador, because if you're frustrated that you're not helping me, if you go with this attitude, they will say, I don't know, I'm not going to engage. So you go with a low expectation and you say, I know that you don't have, you're not aware of this. And then you could give them whatever information you have. And you say, I know you're busy now, but would you be kind enough to consider this? Direct them to something like the EDS Society or any other local patient support group for information. And I think from there, also, I would like to, what patients are telling me is when they show them the spider, for example, to say, I've got all of these symptoms, but actually the biggest impact is this and this for me. And do you think I might be able to do it? Because if you go to your general practitioners, physicians, and you say, I have the dizziness, I've got this, it's very difficult for them to say, or to even, where do they start? So I would say, go with some priorities, give them the information, give them the space to, to think about it, and give them the resources, and be pleasant. Yeah, that's my advice.
I would also suggest that there are local support groups in many places, and those support groups will often be a source for information about local providers. So that's one resource that people can use for finding that multidisciplinary team and the specialists in their local areas. Dacre, we have a question about UVA. When will they start accepting referrals, and also how to find specialists, maybe not in your specific area, but elsewhere in Virginia?
Yeah, great question. We're getting asked that a lot as the wait list grows, but we do have at least an intake contact I can share. So we are accepting patients through that. We're building a center, as for all these reasons that we're talking about today. It does take time, so I'm all of 3 weeks there now. So as you can imagine, it'll take a little bit more time yet. We're hoping for the early part of 2026 when we'll first get to the larger group of patients, and if hopefully we can at least get some smaller numbers here and there. But just as Dr. KazKaz was mentioning, yes, there's going to be a process of building multidisciplinary networks and things like that within our area, and then also understanding what is in the surrounding areas, whether it's in the Northern Virginia, DC region, and so forth. We expect that we're going to have patients come from all over, as most of these core centers do. So understanding how that works, we'll be building it. And was there another part to that question?
Well, it's just the other specialists in Virginia.
Yeah. So, and it's a new area, so I'm still learning. And some are here in attendance to this symposium, but it's been fantastic to network there. But as we know, that it is kind of a larger enterprise, a larger operation across the whole country. So that's what we'll have to keep in mind.
All right. Amelia, somebody's asking about how their provider can apply for the core.
Fantastic. Oh.
No.
We get Amelia's
hear Amelia.
microphone. Here we go.
It's number 8.
Number 8.
I mean, I can talk really loud.
There you go.
I can project, but yeah. So if a group or provider is interested in learning more about the core network, the best place to start, I would say, is on our website. So we have lots of information there about who's already within the network in case they would want to join one, or there's also the program criteria itself, so they can see kind of what they'll be assessed on when they do apply, as well as all the application information, intake cycles, that type of thing. So I would say to start there, or you can, of course, get in touch with our team through the email, too.
Thank you. And Scarlett, there's a question about whether or not the Society plans to develop specialized informational brochures for specialists.
Yeah, we have a lot of plans for content. That's kind of the space that I work in. I didn't really talk that much about that, but I work on creating educational resources. I'm not sure by specialist brochures, I'm not sure exactly what that refers to, maybe management guides.
I think medical specialists and highlighting the particular issues, for example, EDS-related issues in orthopedics or allergy, immunology, those kinds of things.
I think we'll be working on creating resources as new information comes out about management with the Road to 2026. So you can expect to see some of that information kind of translated from the papers into additional resources.
Wonderful. Alan, could you talk a little bit about plans for educational programs through the Ehlers-Danlos Society?
Educational programs more broadly. So I wonder if this question is picking up on us educating undergraduates and getting into universities and getting into schools.
Yes, we have questions about undergraduate education, graduate medical education, working with policymakers.
Right.
You know, sort of, there's a lot of information,
a lot of everything.
a lot of territory to cover here.
Okay, so I suppose broadly speaking, we are very aware of all of those areas. And so one of the key things is to make sure with the limited resources that we have, that you identify where you can get in underneath something and actually make a difference. So if I take the policymakers side of it, for example, there's been work that's been done for some time around how we utilize advocacy, support to get into policy making environments. We've also spent some time with the FDA in the USA, looking at really signaling that we're here and we wish to be part of that kind of process for medications and drugs coming through the system. But we have affiliates, and I'm aware actually that the UK people are here, so I maybe put a little plug in for them. They've been doing huge amounts of work getting into our parliament, getting into our healthcare system, and that's how I think we support this. We can't do everything. But if what we can do is provide that moral support, that infrastructure to support to help people get into the policymaker piece, then great. What I would say, and it's a reflection of mine, and no disrespect to the policymakers, is it's a grindingly slow process, and they move on and we stay, and it's an absolute nightmare trying to maintain continuity. But we'll keep going. And bravo to all of those that have got the energy and the spirit to get in underneath this. With the education side of things, we do a lot of education. We have a lot of modules of education, but the question always comes up: how do you get this onto the curriculum at the medical school? How do you get it onto the curriculum at the physiotherapy school? Again, it's incredibly challenging. There is no room in these curricula to get us specifically in there. So how do we creep in from the edges, from the sides? How do we do this so that we have a voice in the room? A couple of pieces of work that we're doing. First of all, we're working with students from across the healthcare professions who've joined our ECHO program, and we're encouraging them to take that information away and work out how they may engage at their local schools and how we might help them to disseminate information. That's a soft approach. A slightly more fixed approach is massive open online courses. And we have put a program together to build out what are called massive open online courses, which many of you will be familiar with. You go onto these learning platforms like Coursera, edX, FutureLearn, and you learn and you get certificated and you do self-reflection, and then you can do things with that. I'm extremely pleased, I think I can announce this, I think it's fair to say, that we've already been awarded our first year's funding to be able to take this forward with pretty much a guarantee of the second and third year's funding if we do a good job in the first year. And I know that the people who are going to take this on are going to do a brilliant job, and so it's going to happen. People will be able to do these courses for free and they'll get certified. Now the next step with that, once we've demonstrated the value of it, is that the platform that we're going to work with, FutureLearn, have huge connections across the universities internationally. What we then need to do with that is turn those into what are called micro-credentials. And they are formal forms of learning and certification at a university level for all healthcare undergraduates. And that's the next big piece of work that we're going to do, to really get the message in under and provide the support that people need in those learning environments.
Thank you.
Claire, can I ask a quick question? Roberto, did you have a fellowship program at Sick Kids?
Yes, the Ken Rector Foundation in Ontario has funded for the last 3 years a fellowship in which we recruit. It's open for individuals that have trained in pediatrics, in any of the subspecialties related, or in genetics. We happen to have had 2 geneticists and 1 pediatrician. Our first graduate has moved on to work as a geneticist in London, Ontario, and she's looking into a way to open a service for EDS. So I do think that training the new generation is going to be important. I noticed that in our panel we had people from different backgrounds, and I do want to highlight that genetics, although we deal with rare disorders, we're very few to the number of individuals that have rare disorders. And so I think that having people trained from backgrounds that perhaps have more broader representation would also be important.
And can I just, I think it's we were all at a meeting yesterday where we had the most amazing minds in the room. I felt very out of place. And so we had clinicians, clinical academics, and others, and we were talking about the need for the next generation. And one of the things that really came through was this need for to provide the infrastructure support for the training of the next generation within the research labs, within the clinical environment. I think we took that away as very much a program of work we need to explore.
Very, very important.
Just add one thing. I think it's absolutely great, all the efforts and trying to say there will be an online. But the problem is, I think, unless we get into the core of the curriculum, it's the core of the curriculum of the medical school, the core of the curriculum of rheumatologists, how to manage it, regardless of the name. You have this, you have to do the assessment, which I feel that, as I said, I was so proud that this is now part of the curriculum. They have to do it. It's part of the assessment. And also we're working with the BSR, that's the British Society of Rheumatology, is to actually do this fellowship. I presented it prior COVID, and now we're doing on it, where exactly what you're describing. You offer a fellowship when people come sit with you in a clinic. They know how you do the assessment. They come to the MDT meeting, and then they will go and sit even a tiniest little hub in their area, and surprise, surprise, people start seeing patients, and then you have this network. But unless we kindly and politically can do this and insert it in all of this, I think it's difficult to rely on people just coming as an option, because you will be just getting the people who are interested anyway. But it does work. It needs a lot of
it needs all those parts, doesn't it?
a lot, but it does work.
And just finally, is that the other bit of this is if you put things in place that people have to do, they have to do it, then the light bulb comes on, and otherwise they're stuck. So the other piece of work that we're doing is we're looking at the electronic health record systems. How do we get it into EPIC so it's there and it has to be done? How do we get it into primary care EMIS type structures so it's there and it has to be done? And there's almost there's a bonus to the fact that you've done it in order to pick out our patient cohort, particularly at the first responder stage in primary care.
So, for example, what we're working now on getting the SPIDER into EPIC, and what we're pleased with, although we use the SPIDER, which is, as I say, the multisystemic assessment tool, the long COVID clinic found it very helpful. So, so we are actually working on it as we speak.
Yep.
Wonderful. I'm going to ask Serwet a question. There are several questions about how patients can help their practitioners overcome either a lack of knowledge or a disbelief, and what to do when you're faced with a situation like somebody who's not familiar with hypermobility and is making a diagnosis, a dismissive diagnosis of fibromyalgia, for example.
Yes, this is a question we get a lot, and it's a problem that we're dealing with, and we hope that we will get better at this. The way to have a physician hear you, basically, that's what's being asked, is to give them information. And that's quite hard if somebody is dismissive, because you need a good patient-doctor relationship to be able to do these things. So what I would advise, and I think the EDS Society here is quite important in this matter, because they have a lot of information online. As a person who has the disease, it's hard to go looking for research papers to give to your doctor. I mean, some of you will be able to do that maybe, but that's not the most people. And what's so nice about the society website is all the information is there, and it's quite near to each other. So I would advise you to look at that. But also, what's very important is to ask your doctor. So I feel this and this is happening, but try to do it yeah, it's quite frustrating if a doctor is not listening. So try to do it in a calm and respectful way, and ask them, why is it that you don't believe in this type of disease? And why do you think that I don't have it? And I hope that there a conversation will happen. Another option would be to, and you named it already, Claire, to go to a patient organization, because you are not the only one dealing with this problem. And from our standpoint, there's so much we can do about individual doctors or caregivers. What we can do is educate, keep educating, keep advocating, but we cannot change characters, unfortunately.
Drip by drip, right?
Exactly.
One step at a time. Roberto?
Not somewhat related, but I had seen that a lot of people are asking about access in Ontario, and there's one service that I forgot to mention, which is the e-consult service that was created by Ontario Health. It is a system by which a physician can ask a question electronically. It's almost like an advice, but it's a formal advice. It remains documented, and the physician actually gets paid for the 5 minutes or 10 minutes that it takes to answer that consultation, which for people that are fee-for-service model is important too, because otherwise they can spend a lot of time reviewing and not get any reimbursement from it. So e-consult is something that you can highlight to your providers and ask them to place it to an adult. They have a clearinghouse and they assign it to the person that makes the most sense. And so that would be a way to, and it has the option, recommend that the patient be referred for an in-person assessment. But in many instances, it can lead to an initial assessment that is more thorough and a referral that is more complete.
Can I add to that? We were hoping to get that in the Netherlands as well, but we're having difficulties with payment. What we do have in the Netherlands is an email address for caregivers to our expertise center, so they can always contact us, and that's also something I think people can ask. Like, can you contact the expertise center? We have a disagreement in what I have as a person. Can you contact them to get their opinion as well? And we're very open to that. It's for caregivers.
Okay, thank you so much. We have a question here about the value of introducing awareness and sections on EDS in medicine-adjacent fields, such as narrative medicine and or bioethics. Would anybody like to tackle that one?
They are powerful messages. I think that we need to encourage more physicians to do narrative medicine. In the genetic conferences in Canada in the past few years, Dr. Novacek from McMaster has started a chapter on narrative medicine, and there's always one talk in which either a healthcare provider or a patient presents a paper, and they are very powerful. I think that, yes, we could encourage our journals to have more of that. Again, they need to be short enough so that they are impactful, but that people actually read them. If we write a novel, only people that read novels will read it.
Yeah. And I think the work of Dr. Colin Halverson is a very powerful testimony to the importance and the impact that bioethics investigations can have. And he spoke on Friday, I think. He's done really great work over the last 6 years, and I think it's been very, very validating for a lot of people living with EDS and HSD to see the outcomes of his investigation of the lived experience of people with those conditions.
I just remembered something important just about talking about the curriculum. I've recently had we have always emails about clinical cases for finals for medical students, and I've been apparently the biggest recruiter this year. Every patient with any physical sign, because medical students have to learn about this, they will be examined about it, and they're seeing patients. So, and we've arranged through the medical school a workshop where people come and do it as an option. So maybe next year or whenever the next time, I'll tell you about the outcome of that.
Fabulous. All right, this will be our last question because we're down to our last 2 minutes. We have a question whether EDS patients who are also artists, can they contribute to physician education on EDS by presenting artwork that showcases their lived experiences? How can artwork fill in the current gaps in EDS education and awareness for various professionals?
What a brilliant question.
I've actually got a very brave lady with the kyphoscoliotic EDS, and she is an amazing artist. Unfortunately, she lost one eye because of the fragility of the eye, and she had the other eye being threatened. She did the most amazing exhibition in London. Initially, she didn't want to be she didn't want to, like, she saw her art apart from the condition, but then when the condition started affecting her ability to be an artist, she did this most amazing exhibition in London about the eye and the fragility, and it actually provoked a lot of discussions about this. She doesn't want to put herself forward, but in the future, perhaps she, like formally, like with the societies and other people, but in the artwork, she has announced this.
Wonderful. Alan?
We were just thinking about what we do at the Global Learning Conference every year, and every year we ask people to submit things that are important to them, whether it be their music, their dance, the way they feel, the way they're expressing themselves through art. We actually have an enormous collection of that really amazing material. And it seems to me that something we should take away, I'm not making any promises because it always makes too much work for us, is to explore all of that and gallerize all of that, if that's a word, and identify from it how we can use parts of it as part of our teaching. If my husband was here, who is an artist, he'd say, "Why haven't you already done it?" The emotional part of all of that, that's so profoundly powerful, is something that we should take away.
Yes.
It's so rich. It's such a great question, and
Really
I kind
fabulous.
of don't know why I hadn't thought of it before. But thank you so much for helping us think about that, because we should definitely take this away.
We'll have Drake come up later, and maybe we'll sing some more for us today.
Yeah. Drake, Drake's a perfect example of another beautiful piece of art or artistry, and how important it is and how empowering it is, both as an individual and to us. We were in tears yesterday at the was it? It wasn't yesterday. The night before at the gala.
Friday night.
Because it's very, very emotional. It's incredibly powerful, and we should be utilising that. I thoroughly agree.
Well, please join me in thanking our panelists and speakers for an excellent presentation.